patient is bleeding somewhere in his intestines. That might be in the stomach. Even if there are black stools, one should get evaluated for these. Where in colonoscopy, the entire length of the large intestine. So one should be very careful and get evaluated if they observe blood in the stools. Hi, this is Dr. Venu Bhargava. I am a GA, HPB and liver transplant surgeon. Today I am going to talk about the blood in the stools. That blood in the stools can be either red or it can be black. That is depending upon the location from where it is bleeding. So it is an alarming sign. The blood in the stools is an alarming sign. So one should get evaluated for causes of blood in the stools. So what might be the causes? So first we discuss about the causes of fresh blood in the stools. The most common would be like because of hemorrhoids, fissures. These are harmless, yet the patient has to be treated. And other causes like malignancies, like cancer. It can be in the rectum or upper above that thing like sigmoid colon, descending colon. So bleeding can happen from there also. So one should be very careful and get evaluated if they observe blood in the stools. So there are other causes of benign causes like inflammatory bowel disease. This might be because of Crohn's disease, ulcerative colitis, or sometimes if there is any infection in the intestines, that might also lead to the blood in stools. So what are the other causes? Other causes include angiodysplasia of the colon, and sometimes the patients who have underwent stenting in the heart or heart surgeries, they might be using blood thinners. So these patients can also have high risk of having blood in the stools. And sometimes patients may experience black color stools. So when the patient has black color stools, it is also considered that patient is bleeding somewhere in his intestines. That might be in the stomach or upper part of the small intestines, where the bleeding can turn into black stools. So even if there are black stools, one should get evaluated for these. So the evaluation consists of proctoscopy. You should be your surgeon or gastroenterologist, medical or surgical. So the evaluation begins with proctoscopy. If nothing is seen in proctoscopy, they should undergo sigmoidoscopy, or some patients might require colonoscopy, where in colonoscopy the entire length of the large intestine and part of the small intestine will be evaluated. If the patient is experiencing black colored stools, then he should undergo endoscopy, that is upper GI endoscopy, where through endoscopy we can see esophagus, stomach and small part of the small intestine. So don't neglect the sign of blood in stools. Kindly consult your gastroenterologist, either surgical or medical, or your surgeon, and get treated. Thank you.